Good morning and welcome to our Board of Commissioners meeting in Blue Earth County of January 25th, 2022. If we'd all stand now for the Pledge of Allegiance to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we have the agenda review.
Mr. Chair, there are no changes to the agenda today.
Okay.
I'll move the agenda.
It's been moved by Kip and seconded by Clean. Anything difference or additions or whatever anybody thinks? Okay, let's, guess we need to have a roll call on this too.
Commissioner Pat?
Aye.
Commissioner Brunder?
Aye.
Commissioner Stuenberg?
Aye.
Commissioner Landcamer?
Aye.
Chair Pipo?
Aye. Okay, and agenda has been approved. First up is our planning and zoning, and
Morning, everyone.
morning.
Good morning.
George.
Morning, man.
Yeah, that's all right.
Yeah.
We did a lot of stuff at the planning and zoning meeting last month.
Okay. Start off, I guess, George.
Thank you, Mr. Chairman. PC 02-22 is a request from Gary and Faith Hudson. It is for review and approval of the preliminary plat of Hudson Acres subdivision consisting of one lot and one outlot. The property is zoned rural residence and is in the south half of the northwest quarter of Section 22 Garden City Township. Staff presented the report. The applicants were present and had no additional comment. There was no other public comment. The Planning Commission expressed no concern or comment regarding the request. Following the discussion, the Planning Commission forwarded a recommendation of approval of the request to the County Board based on the findings and conditions prepared by staff, and the board action is a resolution.
Okay. At this point, do we have,
I would so move.
Oh, we got to open public.
Okay, okay.
we have public comment? Do we have anybody here that wishes to speak regarding PC 02-22? Nobody, if there isn't, nobody here wishes to respond on PC 02-22? I guess hearing none, bring it back to the board for action.
So moved, Pat.
And moved in second. Any further discussion? All those in favor, just Stephanie, take the roll call, please.
Commissioner Pat?
Aye.
Commissioner Brunder?
Aye.
Commissioner Stuenberg?
Aye.
Commissioner Landcamer?
Aye.
Chair Pipo?
Aye. Okay, that passes. Then we now have what, PC 01-22.
Thank you, Mr. Chair. PC 0122. The applicant is Blue Earth County. This is a request for review and approval of amendments to the Blue Earth County Code of Ordinances, Chapter 24, to allow short-term rental units meeting performance standards as an interim use in the agricultural, conservation, rural residence, rural town site zoning districts, and the urban fringe overlay district. At the Planning Commission, staff presented the report. Two public citizens addressed the Planning Commission with the following items. First, what is the need for the ordinance? The chairman and the Planning Commission stated there is a need for an ordinance due to some issues with existing short-term rental units. Secondly, the follow-up question related to will the ordinance include long-term rental units? And staff indicated there is no proposal at this time to regulate long-term rental units. The third question concerns with all of the citizens had concerns with the placing of their name and number on a public road. Staff indicated the proposed ordinance requires the name and number to be posted on the property where it can be accessed, or it can be on a designated web page for the subject property. The fourth question posed at the Planning Commission: how will the county identify all short-term rental operators? The chairman of the Planning Commission indicated that is somewhat dependent upon the public. Staff indicated Information provided by the assessor's office will be used. Additionally, staff has identified several properties across the county, and we will continue with our public outreach efforts. That was part of our planning process in drafting the subject ordinance. There was no other public comment. Members of the Planning Commission agreed that there is a need for the ordinance. The Commission acknowledged it is difficult to develop a new ordinance. It may not be perfect, but they've tried to make it difficult for good operators. There are, in any type of industry, there's a couple bad apples on occasion. The Commission also thanked the two individuals that provided comment at the hearing. Following the discussion, the Planning Commission forwarded a recommendation for approval of the amendment based on the findings prepared by staff, and the board action recommendation is adoption of the ordinance amendment. Thank you, Mr. Chair.
Thank you, John. At this time, do we have any comments or anybody from the audience to speak? Okay, do you have anything to add, George, or?
I do not, Mr. Chairman.
Okay. Well, then we have the motion, or the, in front of us. Is there any discussion from the board?
Mr. Chair, we maybe should call for public comment three times, just
Oh, I thought you
to
did.
meet the
Okay.
requirements.
Oh. I
Even
thought he
though
did.
there is
I
nobody
thought-
to public.
Yeah, I thought I did that, yeah. Well, at this point, yeah, we call for public comment. I guess if there's anybody even online.
One more time.
Okay. Let's bring it back then to the board. Anybody wishes to?
I'll move approval.
Second?
It's been moved and second. Any discussion?
I don't have any questions or comments, but I just want to acknowledge the staff and the effort they put into this ordinance. It was a great undertaking, and there was some feedback from the Planning and Zoning Board that appreciated us getting this done and how we worked together with the Planning and Zoning Board and this board back and forth, and they appreciated our input and the way it just worked out. And I thought the discussion with the person that was there and testified went very well. So thank you for that, and thank you to the Planning and Zoning Board.
I too appreciate a lot of discussion on this, heard from different constituents, others around the county. How did we end up with, as far as posting names and contact information and things like that? Some were concerned about that, and then maybe just, and then as far as inspecting it and stuff like that. I know from a agriculture perspective, not whether feedlots or assessor or whatever, not so much biosecurity in this case, but that's a question that comes up as well too, is do we know if somebody's going to be on or permission? So that's really two different questions in two different cases, but where did we end up with having to post and having all that information in the public?
Absolutely, Mr. Commissioner. In the application process, the upshot of, the first item as far as like the posting of the information for the property manager, there's flexibility in terms of posting it on the perimeter of the property, where the property manager or the owners would feel comfortable in posting that location. Additionally, they can post on their official webpage, so that would just be a part of the application process, and we're happy to work with folks to say, so what's the plan for getting the word out? We certainly understand that each property can be unique in terms of what would be the most appropriate mechanism for posting that type of information or having it available to the public. So we're perfectly willing to work with folks to identify, what's their comfort level and making sure that that mechanism is available for folks that might identify in some circumstances issues with the operation of a short-term rental unit. That's the intent of it. Secondly, to answer the question regarding, I'm sorry, can you repeat the second part then?
Well, the second one really has nothing to do with this, but I guess at some point I'd like to learn more about how do we deal with biosecurity as well as on feedlots and things like that. not necessarily with feedlot inspection, because I know we do a great job, the awareness is there, but what do we have for the awareness of the assessor's office as far as respecting biosecurity and not being on somebody else's hog farm, you know, the morning before and things like that. So that's something maybe could be addressed at a different time that's really has nothing to do with this.
I can give a quick succinct answer, and maybe Mr. Matterfeld wants to add on to it. In the application process, if someone is looking to pursue an interim use permit for the operation of a short-term rental unit, they sign an application that states that they are willing to have an inspection conducted as part of the review process. It's not anticipated necessarily that additional inspections would be a regular occurrence, but that would be part of the regular application process, so that there is that benchmark in time at the time of application that the property would be meeting the standards of the proposed ordinance.
And I appreciate, even though we only have less than a dozen of these, I think the dozen or 8 or whatever the number is we've got are very different. Where we've got some, you may have landowners that might not even, property owners in the county. I know in my district, we've got some where you have to drive by the landowner's place on a dead-end road to get there. The other one in my district is on the same yard. The owner is, you know, living there and stuff. So I recognize we have some differences on that, but just glad to see we've got that kind of worked through as far as posting that information in the public. Thank you.
Thanks. Anybody else have any comments, questions? Okay. We'll bring it back to the board for a motion.
Oh, we got one.
We already got one,
Yeah,
that's right.
motion and second.
Second. Okay, then Stephanie, would you want to please call the roll?
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Motion carries. Okay, then we are at the PC 0322. Which one of you get that honor?
Mr. Chair, we first maybe have the short-term rental application fee.
Oh, I thought okay.
A little short one.
Yeah, short one, yeah, okay.
Pretty succinct on this one.
Yeah. All right. Do you want to then read the staff report?
Thank you, Mr. Chair. Yes, so this is in follow-up to the previous action item. Blue Earth County is the applicant, and this is a request for review and approval of an amendment to the fee schedule to include short-term rental units as an interim use. The application fee for a short-term rental will be reviewed by staff as necessary as it pertains to the permit review time commitment by staff. The proposed fee is $700, which matches up with the current interim use permit fee.
All right. Any other comments? Okay. We have a motion and second.
Open up for public comment.
Mr. Chair, we do not need public comment on
Yeah,
this.
okay.
This is setting a fee, so
Yeah.
it's not subject to the public comment.
I'd move it.
Okay. Kip moves. Have a second?
Second.
Second by Vance. Okay. Any discussion regarding the motion? Okay. Let's see. Then Stephanie, you want to call the roll call, please?
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Okay. Thank you. That includes that. Then we have the the next one.
PC 03-22 is a request from Blue Earth County for review and approval of an amendment to the Blue Earth County Code of Ordinances, Chapter 24, zoning, to establish standards for the construction and placement of liquid propane storage tanks with capacities of 10,000 gallons or more. Staff presented the report. There was no public comment. The Planning Commission asked staff if a variance would be required when adding a tank to a house located within the required setback, and staff's response was yes. The Planning Commission also indicated that large liquid propane tanks will become more prevalent with today's modern farming practices and the cost benefit of purchasing larger quantities. Following the discussion, the Planning Commission voted to recommend approval of the amendment based on the findings prepared by staff, and the board action is the adoption of the ordinance amendment.
Thanks,
Just,
George.
Mr. Chair, just one point of clarification on the variance component there. It would require a variance if it wasn't meeting any applicable setbacks, but that's only applicable for the larger tanks, the 10,000 or larger. A typical residential tank is about 500 to 1,500 gallons, so won't affect residential properties for the most part. So.
Okay. Then here, call for public comment here. At this time will be opened for public comment on PC 03-22. This hearing is being recorded, so please state your name and address for the record. Please limit your comments to 3 minutes. For those participating via Zoom, you can unmute your line by clicking the microphone button on the bottom of your computer screen or pressing *6 on your phone. And I don't know, does anybody allow it a little time to get to the, okay. Don't see anything there, but at this time, if anybody wishes to comment on PC 03-22, anybody here? There's nobody here. And I see nobody regarding online either. I'll bring back to the board for a motion.
I would move that.
Second?
It's been moved and second. Any further discussion?
Question, so this talks about tanks. Is it 10,000 gallon tank or more, or is it cumulative of 10,000? I guess I'm thinking of not so much in this area, but you get parts of the state with the turkeys where you see the 1,000 gallon tanks, but you maybe have 8, 10 or more where you would be up to that. I think here you typically don't see more than 4 or 5 tanks in a row. Help me understand that.
I think the intent, Commissioner, is that it would be for those individual tanks that are 10,000 or larger.
Okay.
We have seen, or we've experienced some questions regarding some of the larger tanks over the last couple of years, and so we're trying to address that.
Thank you.
And it's my understanding you reached out to some of the suppliers and visited with them about this.
Correct. In the 10,000 gallon threshold, you might ask where that came from. And what our understanding is with talking with his industry folks is that's pretty typical when they need a contractor to deliver the tank at that size, and so that's where that threshold was determined.
Okay, thank you.
That's one big tank.
Yeah.
Okay. And I'll have Stephanie call the roll.
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair People.
Aye. All right. Then we have, let's see, we have, oh. Are we all done?
Nope,
We got
PC 0422.
0420-22. I'm looking at it and thinking, okay.
Thank you, Mr. Chairman.
Yep.
PC 04-22 is a request from Blue Earth County for review and approval of an amendment to the Blue Earth County Code of Ordinances, Chapter 24 zoning to establish standards for accessory buildings. The ordinance amendment provides definitions and establishes performance standards for the construction of accessory buildings. Staff presented the report. There was no public comment. The Planning Commission expressed no concern or comment regarding the proposed amendment. Following the discussion, the Planning Commission forwarded a recommendation for approval of the amendment based on the findings prepared by staff, and the board action is the adoption of the ordinance amendment.
Okay. At this time, we'll open for public comment on PC 04-22. This hearing is being recorded so please state your name and address for the record. Please limit your comments to 3 minutes. For those participating via Zoom, you can unmute your line by clicking the microphone button on the bottom of your computer screen or pressing 6 there on your phone. We have a comment at this time. Anyone wishing to comment on PC 04-22? Last time, anyone wishing to comment on PC 04-22? And if not, we will close the public comment portion. Move it to the discussion of the board.
I'll move approval.
Okay, it's been moved by Kip Runter. Is there a second?
Second.
Second. Okay. I have a motion and a second. Stephanie, please say, well, if anybody have any discussion?
I don't have any questions or just a comment again, that this is something that George and I have run into several times out in the rural area with why can't I build one building? And this does not pertain to ag, so you can, because it's only 3,000 square feet, if I remember right, off the ordinance, which I think is just a little small, but the Planning and Zoning Board thought that was a good number, so I didn't win that discussion. So I just want to make sure everybody understands that it's not for ag buildings. This is just for someone that has the property out in the rural area and wants to put up a building without a house. So I think it's a good ordinance and it'll work good.
That kind of was what my question was. What precisely is an accessory building? What does that equate? Any building that's off the...
It's not a house.
Besides a house? Like a garage could be an accessory building, anything?
Mr. Chairman, I could read the definition from the ordinance here. It says accessory building means a building that is clearly incidental or accessory to the principal use of a lot or a building located on the same lot. So part of the struggle that we've had over the last few years is when there hasn't been an apparent use of that property, it's a vacant land, what is that use of that property? So then we would likely go back to the zoning, conservation or ag or those types of things. And so in the ag district, as Commissioner Brunner stated, there is no requirements if you're going to, for size, if you're going to use that building for agricultural purposes. But if you were in the ag district, you were zoned ag, but it was a residential building site or something like that, then you would be limited to the 3,000 square feet.
Makes perfect sense. Thank you.
Okay.
But in this case, an accessory building can be an initial building, correct? I mean, when we think of accessory, we think of
Off the
a
house.
second one or whatever, but it could be the first building on that lot, correct?
Yes.
And refresh my memory, if I have a house on the lot, what is my restrictions for the size of the building? The accessory building, is it still 3,000?
To this, correct, George?
Cumulative.
Cumulative, okay.
In those certain, if they're not used for ag purposes.
Right.
Yeah.
And we've never had, have we had a size for the accessory buildings on a home site?
Not currently.
Yeah, so that might be where we might run into a little bit of an issue. So if I have a house there, and I want to put up a 60 by 100 building for all my stuff, in the past, that was okay. Now we're going to tell them, no, it's only 3,000 square feet.
Unless it's used for the ag purposes,
Right,
which
yeah,
is
no, that's-
typically what we see the larger buildings for.
Yeah, there's not very many of these in like 20 years
So,
George and I have
If
had.
somebody wanted to put up like a pole barn for, to store, let's say, a camper in or something like that, they couldn't do that?
Yeah, up to 3,000 square feet.
Up to 3,000
Yep.
square feet, which is what by what?
Well, 40 by 80 would be 3,200 square
200.
feet, so it would just be slight of that.
All right.
I believe the 3,000 square feet, correct me if I'm wrong, George, but Scott in our office did a query for, out of our permitting system for buildings that we had issued, generally speaking, and they were around that threshold in the past, if I
I mean, that's-
remember the last 10 years or so.
That's a big building for stuff. I mean,
For
as a
residential.
Lot of
residential.
toys.
Yeah, for a residential person, technically a residential person out in the ag district, so. It certainly is supported in the rural town sites and,
And we can, if we're running into some problems with this ordinance, we can always revisit it, or if there's a practical difficulty, a variance, could
Yeah.
potentially be sought or something, so.
okay, good discussion, thank you.
Sounds good, thank you.
Any further? Okay. Then back to the board here for a motion.
We got one.
Already did get one.
Yep.
There we end up. Okay, those have Stephanie call the roll.
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Okay, motion carries. At this point, we're complete
Thank you, gentlemen.
We're done, and appreciate it.
3 ordinances done,
Yep.
so thank you very much.
Thank you, that didn't take.
I haven't added any to your list yet, so just, the list is getting smaller.
Yeah, it's going good. Stay warm.
All right, we have the,
Thanks, Gary.
John here?
yep. We have the, it's not here yet?
He's coming in now.
There he is. That's- He was just waiting,
He
and
just had to give his grand entrance.
Carrie thought it was her turn, so we
waiting in
were
the wings.
debating who was supposed to go first. So Carrie's waiting. Good morning.
Good morning, John. Introduce yourself and,
John Marzalek, Community Corrections Director.
okay, great.
I'm here this morning in regards to the Blue Earth County Community Corrections 2022-2023 Comprehensive Plan. So attached to the memo, you'll find a portion of our 2022-2023 Comprehensive Plan, and also when there is a grant agreement between the state or the Department of Corrections and Blue Earth County and Community Corrections. The Comprehensive Plan is something that's required and is approved by the Department of Corrections, and we've gone through some of that review process with them already. The plan updates the Department of Corrections on the status of the Blue Earth County Community Corrections Department. Does an overview with some statistics of crime rates and also the clients that we serve, budgetary processes, and also some strategic goals are included in that full report as well. Once that full report does receive kind of that final approval and all signatures are on there, then a full report will be provided to all board members. And I would just respectfully request that the Blue Earth County Board of Commissioners approve that grant agreement and the 2022-2023 comprehensive plan.
Okay. Thank you, John.
I'll move approval.
Second.
Okay, Kevin, Kip moves approval, second by Kevin. You have any questions, discussion?
Nope, just a great program. Appreciate all your hard work on it.
Thank you.
Yep, yeah, thank you much for all that. Okay, hearing none, then let's have Stephanie call the roll.
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Struenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pepo.
Aye. Motion carries, and appreciate your hard work.
Great.
Thank you.
Thank you, John.
Yep.
Good seeing you.
All right, and we have, next we have the Help America Vote Grant Agreement.
Yes, Mr. Chair,
Yep.
our IT Director, Carrie Harvey, will be joining us. Come on up, Carrie.
Good morning, Carrie.
Good morning, Carrie.
Morning, Chairman, Commissioners. So what I'm bringing before you guys today is the Help America Vote Grant Agreement that we are submitting for. It is a co-agreement between Property Environmental Resources and IT to help improve voter accessibility to elections and to improve our security around elections. The HAVA grant will be about $30,000, doesn't include a county match, so that's great. And it is to help us be able to improve our security. We're looking at things like door accessibility and some network monitoring tools. So we're hoping that we can, along with PER and IT, to request the Board of Commissioners to approve the resolution authorizing the acceptance of the HAVA grant as required by the grant application process and state law. Additionally, the resolution authorizes the IT director to sign, execute, and implement the projects resulting from the grant.
I would make that motion.
Okay. Oh, so we had a second, first and a second, looks like. Let's see, I don't know, did you hear us before, Colleen? Yeah.
I did.
Yeah, okay. All right, we have the motion in front of us. Any discussion regarding that?
Another exciting opportunity.
Yeah.
It is, absolutely.
Yep, very much. So, all right. Hearing none, then I'll have Stephanie call the roll.
Commissioner Pat,
Aye.
Commissioner Brunder,
Aye.
Commissioner Struenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pepo.
Aye. Motion carries, yeah. Thank you much.
Thank you, everyone.
Thank you,
It
Carrie.
helps
Thank
out.
you.
Okay.
ditch stick.
Yep, ditch.
The preliminary hearing was continued.
Wish to continue then with
County Ditch 92.
County Ditch 92.
Just have a quick memo. Good morning. Petition for removal was received by Property Environmental Resources Drainage staff on December 8th of 2021. Under 103E.805, the petitioners ABC Holdings, LLP, are seeking for removal of properties from County Ditch 92 public drainage system, including removal of benefits on petitioned properties. We are asking the Drainage Authority to appoint a viewer for the review of the effects to the County Ditch 92 public drainage system as proposed by current petition, including potential changes to current benefits listings and future maintenance costs to the system. A viewer report is requested to give a final report to the Drainage Authority before granting approval of said petition. We're asking the Drainage Authority today to approve of said findings and ordering the appointment of viewer for the proposed petition for removal by ABC Holdings LLP. That is all I have.
Okay, thank you.
She is going to talk about some of her programming and then COVID as well. The first item for your attention is under supportive housing. It's a grant that we carry with the Department of Human Services for regional housing and carrier contract, and she decided she did not want to continue with that. We are offering her $1.50 an hour, which is the standard this year, and you'll see a slight increase in hours by about 100 hours in the contract, not to exceed language of license. The hourly rate won't change, but we do have a $10,000 stipend that's added into her contract, and that's the change represented here. The term, July 1st of 21 through December 31st of 22, stays the same. And her clinical director duties would begin as of January 16th, so there's a slight prorated piece there. That's it for the clinicians. We do also carry a third-party employer of record with Alliance Healthcare, and we have needed this in order to both recruit and retain our professionals, especially in the mental health center, and others that sometimes don't fit within our current employment scope, or the people want to be on contract. So advanced practice nursing is the most common one. This is a strict renewal, but I did want to bring it to the board's attention just so you're aware of this on an annual or biannual level. And let's see, no changes. They receive an administrative fee. I think it's 20 or 25% of the gross contract. And then the term January 1st of 22 through December 31st of 23. South Central Community-Based Initiative, also called our Adult Mental Health Initiatives. This is the area that we're very concerned could be cut this legislative session, so there's been a lot of talk about this. This particular action item is just about renewing the contract with our 10 County Joint Powers Board entity. What the change that's in there in the middle of the paragraph is looking at serious mental illness and SEDs, serious emotional disorders. These are all titles of certain diagnoses that get grouped together. So our current South Central Community-Based Initiative, you've probably heard of serious and persistent mental illness, SPMI. That's the most kind of acute or most severe diagnosis set. And so that's what the initiative is formed around, is 4 diagnoses that go into SPMI. Major depression, bipolar disorder, schizophrenia, and borderline personality disorder. So just those 4, that's what we've built this whole big instrument around. What we're asking for is a little leeway to coordinate care, not use any of those funds, but for 2 other really significant populations. SMI, serious mental illness, is the next step down. That's a lot of, like all the rest, if you go to a mental health center, all the other diagnoses go into SMI. It's a huge group of people. We're not using any of the funding for this purpose, but we want to coordinate our care with SMI providers and talk about that on a continuum of care. And then the final one is serious emotional disorders, is the kid side.
And already our mobile crisis through the Crisis Center has been willing to go out and serve children, which is a huge undertaking for them. And that's the example of what we need to do. We can't kind of live in silos, if you will. So all we're asking for is permission to have those discussions as part of our Joint Powers Board is the importance. We are nervous, Bob and I talked about this, about we don't want to have the money bleed because it'll just eat us up. The volume of both of those populations are quite significant, and so it'll deteriorate what we're doing with that most severe group. So that's what we're asking for. And the coordination with the 10 counties is what's important to us. There are no rates as part of the Joint Powers Board agreement, and the proposed agreement would begin February 1st of 22 here. Public health, yep, my last item. Greater Mankato Area United Way, this is Kelly's baby. She works really hard behind the scenes, and one thing that we talked about is making sure just to, again, bring it before the board and pass it and review. This is a renewal of our partnership agreement. Again, there's no money in this agreement, but just to make the board aware that there's a lot of work behind the scenes going on. First steps, home visiting and early intervention, are the programming that we use United Way's funds for. The agreement basically outlines the terms, nature, scope, and communication expectations, along with budgeting and responsibilities for each of the agencies themselves and ourselves. And funding levels will be announced after the United Way campaign has been completed. The term January 1st of 22 through December 31st of 22. Mr. Chair, those are my action items for today.
Okay. Thank you.
This is Landcamer. I'll move the action items.
Okay, Colleen Landcamer moves the action items. Van Struberg seconds. Any discussion? Okay, Stephanie, take the roll.
Commissioner Pap?
Aye.
Commissioner Brunder?
Aye.
Commissioner Struenberg?
Aye.
Commissioner Landcamer?
Aye.
Chair Pipo?
Aye. Okay, motion carries.
Thank you, Mr. Chair. We do have just some of the informational items. I said Kelly already that she's going to talk a little bit about programming updates. We certainly want to invite any questions, even out of the scope of what we're picking on. Sometimes it's hard. We put our heads together and think, what do you guys want to know about? So anything under the public health realm is fair game and kind of on an open, ongoing basis. And she'll also give us a COVID update as well. Kelly?
Good morning.
Good morning, Kelly.
Morning, Kelly.
Thanks for having me again. I'll start with the program updates that Phil talked about. So our waiver managed care programs, which are focused on folks that are over 65 in our county, as our other SHIP staff, Gretchen is still heavily involved in our COVID-19 response, including doing a lot of the tracking of statistics. So I'm doing some cross-program work there. Our WIC clinic continues to provide nutrition education and vouchers to qualified families who are pregnant and have a child up to the age of 5. Families receive vouchers to help them purchase food, milk, or different nutritional supports at a local grocery store and the farmers markets when it's a little warmer than it is today anyway, and we have those. They continue to provide their services telephonically. There's still a waiver in place at the federal level. We've actually increased our caseloads a little bit during the last 2 years. The telephonic ability, or the ability to do remote check-in, is a lot more convenient for families than having to load up 3 kids and head to a clinic, and even if the wait in the waiting room is short, it's just very convenient for people. We continue to provide maternal child health services. My nurses go into homes or again do telephonic or remote supporting breastfeeding, growth and development of infants, including those born premature or with other health needs. So a very essential service that we have continued to provide throughout the COVID-19 situation. And then the last child and teen checkup program, which is coordinated by our health educator at this time. She outreaches to children 0 to 21 to reduce barriers to access medical care, because prevention is definitely key. She also works with clinics to provide trainings and coordinate trainings on hearing, vision, and other elements of in addition to the response. Any questions?
Do you have any questions of Kelly or Phil? Okay. Appreciate it very much, and thank you for the information. So
Yeah.
were relevant today.
Yeah.
So,
And then on to our COVID-19 response. So I still have
okay.
this, it's just in thinking about this response, it's definitely been one of the most watched or monitored health events in all times. I mean, just it's amazing. Literally every day there's new information, there's new studies on some aspect of the response. Some are good sources of information, some are maybe not such great sources of information. But there's really no, when I first came, we'd talk about, what's the vaccination rate, and that was the statistic we talked about. But there's really no one statistic anymore that captures the entire situation. There's a whole body of research and statistics and information that really help us frame this more effectively. So I'm going to go through some of those sets of information this morning. As of yesterday, the total Minnesotans with at least one vaccine dose was 3,816,297 people. In Minnesota, 73.2% of Minnesotans 5 and over have at least one vaccine dose. So that's significantly higher than the last time I was here.
Wow.
Good news.
That's
That's
pretty
good.
cool. Yeah.
In Blue Earth
Like
County.
to see it over 90%.
Right? In Blue Earth County, we have 67.2% have at least one dose. In Minnesota, 68.6 have completed the series, so that's 2 doses for Moderna or Pfizer, or 1 dose for Janssen. In Blue Earth County, 63% have completed that series, so we're just slightly below the state average, but right in there. And the over 65 group, 96.8% have at least 1 dose, and 93.1 have completed the series. In Blue Earth County, 99%
Gee.
of those 65 and over
That's
have
older
completed the entire series. So those numbers continue. I think we're at like 98, and they just have come up that percent. Booster doses, the MMWR, or the Morbidity and Mortality Weekly Report, shows 3rd doses, and 3rd dose could either be 3rd dose for immunocompromised or booster. Those are both being considered 3rd doses in this study. Are effective in preventing emergency room or urgent care visits. So 94% effective during Delta and 82% effective during the Omicron. So that's good news as well. Breakthrough cases continue to be monitored and continue to support vaccination as a tool in in reducing severe death and disease. The total breakthrough case rate is 6.923. But the percent of fully vaccinated people that are hospitalized is still at 0.207. So very, very low. I mean, creeping up a little bit, but very, very low. And the total deaths of fully vaccinated people is at 0.039.
Oh, okay.
So those are
That
small statistics. Any questions on that part? Otherwise, I do have a few more. The infection.
Can I make a comment on that part? It just shows how important the vaccines and the boosters are. I'm kind of curious, and I don't know if you have that number, but for people who are unvaccinated, where those numbers are.
So for hospitalizations, like the actual numbers, Commissioner, or?
Yes. Hospitalizations. And I know when we talk about people who have come down with COVID, all those numbers aren't right because people who take the test at home and the MDH never hears about it.
Correct. So that's why the picture when we used to look at case rates per 100,000 made sense to just look at that, but now that is not a full and accurate.
Yep.
Case in point.
Grant?
Our last board meeting, I wasn't here because January 1st I came down with COVID. And I've had my 2 shots plus my booster. But thank God I had my 2 shots and my booster because it was basically a head cold, and I would consider it more like a minor flu feeling, and tested positive for probably about 2 weeks. But I never had to go to the clinic. I never went to the hospital. Within 4 days, I was feeling fine, but I was still testing positive. Had constant talk between myself and my doctor, texting back and forth as to what I should do, and he said, "You're fine. you know, after 10 days, I was off quarantine, but I still tested positive. And, but if it wasn't for the shots, man, I wouldn't, I mean, I know, I mean, just the way I felt, I know it would have put me into the hospital. So, you know, but not one of those things were registered on the state because I never did. I mean, I had, the tests I took were the ones you buy at the pharmacy, and it's, you know, so, but if you can just get it through people's heads that, you know, get your shots, get your boosters, and, you know, yeah, you can still get COVID, but the beauty of not going into the hospital and not having to be on a respirator is amazing.
Right, yeah. Yeah, I have had, over the last few weeks, have had people I know that are in the hospital on ventilators in Minnesota, so.
Unvaccinated.
Yes.
Yeah.
I mean, it's, when you look at the people that are in the hospital, you know, you look at what we have, 63% that are got shots now. You look at the folks in the hospitals, it's between 80 and 90% are unvaccinated that are in the hospital. Well, that's a clue. My own law enforcement tells me that's a clue. You know, saying, yeah, shots work.
Yeah.
And, but.
Yeah, the rates of hospitalizations and, you know, when we're looking at that 0.207 and 0.039, those are the statistics that tell you how effective the vaccine is.
Yep.
That's just amazing. I'm just excited and amazed that continues to be so low. That's just wonderful.
So, Mr. Chair and Kelly, that .2 statistic, is that fatalities, and those were fatalities of people that were fully vaccinated? Am I saying that correctly?
So actually, the total deaths was a 0.039%.
Oh, wow.
So
Of fully vaccinated.
0.039.
So I think to Commissioner
So-
Landcamer's question too, you could reverse that statistic. So everyone else, like way over 99%, were either partially vaccinated or not vaccinated at all. I think that would be probably fair to say.
Yeah, the balance obviously would be.
That are fatalities, right?
And we've seen, so the vaccine is working. We're seeing some evidence that there's some decreases in stabilization, some of the other statistics. So, you know, global incidence and death stabilized the week of January 24th. U.S. incidence decreased 15% over the last week. New hospitalizations decreased 8%. And locally, hospitalizations have leveled off, at least as of last Friday. There were still 1,471 COVID positive patients in the hospital. That's a lot of people.
In Minnesota.
That are
In
still
Minnesota.
in Minnesota.
Yeah.
Yeah, a decrease of 45 from the week before, but the week before was a record number, like we hadn't ever seen. So 241 were in the ICU, and 1,330 were in the med-surg beds.
So we're hearing from the federal and the state medical organizations, including the governor himself, that's saying that there's a strong likelihood that the Omicron now will, you know, after it hit its peak, will take a dive. So within 2 or 3 weeks, we may be pretty much in the clear. But what are you hearing?
We're hearing some of the models are saying this week things will start to decrease dramatically. We're hoping that it decreases.
Yeah, you're always in. You're always hoping.
We're hoping.
You know, and not trying to foresee anything negative, of course.
Right.
But that would be a welcome to so many people, including our healthcare workers and stuff that are just well overworked.
Yeah.
Yes.
And
Yeah.
thank you, Kelly, for all the work that you've done and your staff, because it's, you know, it makes a big difference.
Thank you. It's been an honor to serve our community. I mean, last night we received an essential services request, which of course when rates go up, people can't leave and all of a sudden, oops, I have half a gallon of milk in my refrigerator and I have 4 kids. That isn't going to last 10 days. So last night, we were picking up groceries at 7 o'clock at night, getting milk, getting Tylenol, and delivering it to, a person that needed that had family and had children, and they're so thankful. It's just, those are the things where you're like, oh, it's 8 o'clock and I'm out here in the cold and it's freezing and I'm hauling a wagon and getting these groceries to where they need to go. But then you see the person and they're so thankful and you're like, that's why we do what we do. So that helps us keep going.
You go above and beyond, actually. With that.
Thanks.
Yeah.
So, and just all of the partnerships in our county, from the just dispersing test kits over the last week, working with Open Door and Minnesota Council of Churches and WellShare and Nicollet County to get test kits out to all sectors of the county, cities, towns, groups and organizations that could use them. The collaboration is just amazing. And we're going to be doing the same with some KN95 masks when we get those from the state. We're working with the coalition and emergency management to monitor some of the impact COVID-19 is having on our healthcare system still. Even with a decrease, there's still going to be some challenges for our system. Staffing still continues to be an issue for them right now. We've partnered with our human services staff who stepped up one night to help us with someone they already had an existing relationship with, and we were doing other essential service requests, and they were able to manage that one with the person they had a relationship with. So that was very helpful. Again, and I think it was around 8 o'clock at night while all of this was happening and rolling out. And then last week, I think this was super exciting. So the Mankato Salvation Army had contacted us. They were interested in providing isolation space for guests during their day shelter, but they wanted consultation with public health to make sure that the space was set up correctly. So we went down at 3:30. By about 4:45, we had a plan in place. I don't know, around 6:30, I can't remember the exact time, but it was quick. We had pipe and drape. The city helped us out very quickly, pipe and drape, just to have a visual barrier for that space compared to a different other space, and other PPE or masks, gowns, gloves, cleaning supplies were dropped off before 8 o'clock the next morning. So an isolation space was set up that quickly, and then the work between Salvation Army and Connections is just remarkable. They're like conductors. They had a whole plan in place about who leaves which shelter first in the morning, and then a reverse in the night, so that we reduce and mitigate possible transfer of the virus between folks positive for COVID-19 and those who are not. So just amazing.
Mr. Chair, that backstory, if I say this right, Kelly, correct me if I'm not right, but the hockey thing was going on in town and the hotels were plumb full, and they've been really good partners too as far as trying to get isolation when we need it in certain places. But there was no option there. It was just packed, and so this was in the midst of what felt like a surge to us, because we didn't have the tools in our tool belt that we usually have, and so there's this scramble going on, and we were literally saying, do we buy boots and parkas and have people that are homeless try to tough it out? And it was cold like it is today. And so, I mean, we really were at the bottom of the barrel in Salvation Army.
Who has boots? Who has Carhartt? Who like all those? Like, how do we keep these folks warm? Where do we put them? They're sick, and then you're outside in the cold. So yeah, our organization's stepping up, and those partnerships were just fantastic, effective, efficient, and serve our community.
Thank you much.
If you guys need some more PPE stuff, South Central EMS has a pretty good supply of it, so just let me know.
Yeah, sounds good. Thank you very much.
When you mentioned gowns, masks, I think they have all of it, so
good.
Let us know.
Thank you. Well, thank you all.
All right, thank you, Phil and Kelly, very much.
Thanks, guys.
And
keep up good work.
Good day.
Thank you.
All right. We're down to administration.
Mr. Chair, the first item is the county board minutes for January 4th.
Move to approve.
Been moved, or a second?
Second.
Second.
Oh, pardon? I didn't hear that, Clean.
She said she second.
Did she second it? Oh, I thought we heard, okay.
Yes.
Give me the second, but, okay, Clean seconds. Any discussion? All those in favor? Stephanie, take the roll, please.
Commissioner Pap,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Motion carries.
Next are the bills for the 3
The
weeks
bills.
indicated.
So moved.
Been moved by Kevin,
Second.
Kevin by Kip. Okay, any questions? Okay, not hearing none. I'll have Stephanie call the roll call.
Commissioner Pap,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Motion carries. Okay. and we
Mr.
have-
Chair and Commissioners, item number 9 in your packet is the Human Resources Department agenda. We have quite a bit of activity. Our Human Resources folks have been very busy over the last few weeks, starting with filling a medium equipment operator in our Public Works Department. We also filled a Public Health Case Aid position in our Public Health Unit in Human Services. Item C is filling of a 911 dispatcher position in the Sheriff's Office. Then we also filled a eligibility specialist position in Human Services. We had a lateral transfer of an assistant county attorney that ultimately then resulted in the recruitment being initiated for filling an assistant county attorney on the civil side. We also initiated recruitment to fill a senior land use planner for natural resources in our property and environmental resources area. We had a lateral transfer of an existing employee to that position, and so the backfill of that position then is the initiation of recruitment for a GIS and technology coordinator in that department. We did have a resignation of a correctional officer in our jail, and so we've initiated recruitment to refill that full-time position. We also had a resignation of a part-time correctional officer, and so we've initiated recruitment to refill that position. Then in the License Center, we had a number of changes there of a License Center specialist, so we've initiated recruitment to refill that. We also had some other resignations in the License Center, so item P and item S are both positions that have been vacated, so we've initiated recruitment to fill those positions, and we already have filled one of those positions. And then kind of down towards the bottom, item U is a resignation of a social worker in our child foster care and family child care licensing area, and so we've initiated recruitment to fill those positions. I will tell you that a number of these resignations are related to people that have kind of reached the end of their careers, or at least here with the county. So, you know, it looks like a lot of activity, but some of these are kind of on the positive side, that people are kind of heading to their next chapter of life, so.
That was my question, and it sounds good then.
Any
that's the case.
questions that I can answer from any of these items?
Yep. Any questions of Bob?
Nope, busy time.
Okay.
All right, Mr. Chair and Commissioners, item number 10 in your packet is a memo and grant agreement for the Violent Crime Enforcement Team grant agreement. This is a 2-year agreement providing funding for our drug task force. And so we'll be receiving $195,000 a year, or a total of $390,000 has been awarded to the Sheriff's Office. So recommending approval of this grant agreement.
I would move to approve.
Vance moves approval of the grant agreement. Is there a second?
Second.
Second. Any discussion?
Always a good thing to try to help and get the help the law enforcement get the crime off the streets.
Yep. All right. Hearing none, we have a motion for the grant agreement for violent crime enforcement. Stephanie, take the roll, please.
Commissioner Pap,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Okay. Oh, I didn't. Aye. Okay. Well, motion carries.
She's in the lobby of a hotel, so you're hearing
Yeah.
work talking in the background.
Oh, okay. Okay.
Mr. Chair and Commissioners, I have number 11 in your packet then is a memo regarding the Natural Resources Block Agreement, Block Grant Agreement. This is an annual grant that the county receives, and it involves two separate state departments, Bowser and PCA, I believe. This is a grant agreement that will provide $50,000 basically in 2022. A little different amount for 2023 just because some of the PCA dollars for septic systems has not been transferred between the two departments, so we anticipate that may happen in the future. But we have included a resolution with the memo indicating that the board would delegate signing responsibility to the Property Environmental Resources Director, which will allow us to administer this grant because there will be additional documents that will be needed, but recommending approval of this grant agreement and resolution.
Is that in front of us then? Have a motion to approve?
So moved.
Grant? And second?
Second.
Second by Vance. Okay, any discussion, questions? Bob regarding? Okay, hearing none, then Stephanie, you want to take the roll call, please?
Commissioner Pap,
Aye.
Commissioner Brunder,
Aye.
Commissioner Stuenberg,
Aye.
Commissioner Landcamer,
Aye.
Chair Pipo.
Aye. Motion carries. Okay.
Mr. Chair and
Left.
Commissioners, I have number 12 in your packet is the December financial status report. This is the end of our fiscal year for 2021. You'll see that our total revenues were just under 130 million compared to a budget of about 114 million. So quite a bit more revenue than anticipated for a number of reasons that I can talk about in just a minute. Compared to expenses of just under 116 million, compared to a budget of about 114 million. So our expenditures were much closer to our anticipated budget than our revenues were. When I looked at the revenue side, you'll see the state and federal line came in at 60.5 million compared to a budget of 46.4 million. As you're aware, we did receive CARES dollars as well as American Rescue Plan dollars that contributed to that, but there also was quite a bit of additional revenue in our public works area. So we had almost 2.8 million of CASA money that was above our budget. We had $2 million of turnback funds that exceeded our estimate. And then we also had some federal advance transportation funding of about $2 million. So when you add all that up, you know, it's in that $14 million range. We also, if you look at the fees line, you'll see that we were about $2 million over our budget there. 1.2 million of that was cost reimbursements from city partners on road projects, so it's more of a timing of when those revenues are received. But we also had insurance receipts that were about $800,000 above estimate, so very strong performance there. On the expenditure side, you'll see that our contracts and fees were about $2 million over budget. About $1 million of that comes through our public works expenditures, and so again, it's largely timing of when road projects get billed out. But we also had $1.3 million of business assistance grants early in 2021 that were an unbudgeted expenditure as a result of those CARES dollars that we received. You'll also see our building and equipment purchases exceeded our budget by about 1.4 million. A lot of that is ARP dollars that we spent after we received those funds on cybersecurity and network enhancements and some deferred equipment expenditures in our public works area to utilize those federal funds that were utilized. But clearly we had a strong year. We had budgeted a $2.6 million deficit, and we came in on the positive by almost $14 million. So kind of an unpredictable year because of COVID and some of the federal funding issues that surfaced.
Mr. Chair?
Kip?
So Bob, the money you were talking about that we got for the highway department for some of the construction projects, will that money go out this year, or was that just the timing issue? Because a lot of times we'll get that money, you know, December, but we got to pay the bills. But is that the case with this money, or has that money already been paid out?
No, I would say that there's a good portion of that money that will be expended in 2022, especially the turnback project on County Road 1. You know, we've now, I think, received almost all those turnback dollars, but we've still got a major portion of that road project left to do. So very different picture is likely to occur in 2022. We do, though, expect another $6.5 million in ARP funds in 2022 to make up our full 13 million roughly of ARP funds we're supposed to get. So we've got a lot of spending left to do in that ARP area, which is allowed through 2024 and even beyond that if we have projects that are approved prior to the end of 2024.
Thank you.
Any other questions on that financial status? Otherwise, I'd move on to the rest of the report.
Go ahead.
The Ponderosa, the enterprise fund at the bottom of the first page, you'll see that revenues were almost $5 million against expenses of $2.7 million. So we had a very profitable year with the Ponderosa, mostly because we didn't do any cell improvements and didn't have some of those major machinery costs in that year. So this is one of the years where we bank a little money to offset those years where we have those major expenses to deal with. The second page then shows our cash and investment balances. Our total county funds, a little below the middle of the page, is at $132,616,000. You know, that's a very strong performance, again, an increase from the prior year as we've had this excess. You look at our total available funds towards the top of the page at 73 million compared to our 6-month operating needs of 55 million. You'll notice as you look in the detail that our public works area jumped from last year of $7.7 million in fund balance to over 16 million. So a large portion of that increase that we're seeing sits in that public works area, and I do anticipate that that number will come back down in future years. Otherwise, things are looking well. I just maybe draw your attention to the law library line under the dedicated funds. We have been running a deficit for a number of years there. I am pleased to say that the deficit is getting smaller. We probably still do need to take a look at that fee before the middle of this year, but we're going in the right direction now, so appreciate the work that's been done to change that.
Wasn't there an increase in that law library, Pat?
I'm sorry, what's that?
The law library fee, wasn't there a requested increase on that?
That'll be coming up. That should be coming to the board because it has to have board approval before July 1st, I believe. I don't believe it was done last year, but they're looking at that and comparing to other counties.
Yeah, I think we missed the July 1st requirement to approve that fee last year, so it'll need to be done this year.
We need to make sure that we don't miss that again. All right, thank you.
Any other questions, Bob?
That's all I had, Mr. Chair.
Thank you. With that, conclusion there, I guess we just had our commissioner reports. Who will we start with? Lance, we start with you?
Sure can. Well, last meeting we had was January 4th, and even though I could not attend the meeting, I watched it on YouTube.
Yeah.
So I was able to watch it in the comfort of my home and my lazy boy, and watch you folks.
And you didn't fall asleep on us, so it's good.
You know, it was a riveting show. Afterwards, I was able to be at the work session on Zoom, and on January 10th, I had a Arts and Cultural Heritage Fund meeting with TDS. I had a Parks Board meeting and a Detox Board meeting. On January 12th, I had the Blue Earth Nicollet County Safe Roads meeting. On January 14th, had the Transportation Alliance Legislative Committee. On January 18th, we had a work session. On January 20th, I had a TDS board meeting where they placed me, or they elected me as chair of the TDS board.
Congratulations.
Yeah,
Well,
congratulations
there you
on
go.
that.
On January 21st, I had a Rural Action Caucus meeting, and yesterday there was a NACO Arts and Culture Committee Zoom meeting. Today, after the board meeting, I'm having my first Equity and Grant-Making Administration Working Group kickoff, which is a joint meeting with NACO and the Department of Justice. I was picked to be on that board, and I think they was one of maybe 8 or 9 commissioners across the United States. I'll be a member of a small working group focused on equitable grant-making administration to reduce racial and ethnic disparities in the justice system. The goal for this working group is to convene representatives from counties or organizations that support or provide funding to community-led organizations to tackle the issue and develop principles for other jurisdictions to seek and administer funding in more equitable ways. That's my end of my report.
Okay, thank you, Vance. Let's see, let's go to the other side to Kevin.
Okay, since the January 4th board meeting, the work sessions have been mentioned already. Participated with others in the department head meeting. On the 6th, we had our first Soil Water Conservation District meeting. Also attended the Bowser Drainage Work Group meeting on the 13th. On the 14th, we had JD 15 and CD 56 landowner meetings. Yesterday, we had our first true advisory committee meeting, as well as the NACO Ag and Policy, as well as the Rural Minnesota Energy Board meetings. So some discussions on short-term rentals, they were talked about this morning. And upcoming this week, I've got LeSueur and Gaberba watersheds. That concludes my report.
Thank you, Kevin. I'll take Kip.
All right, thank you, Mr. Chair. After our last county board meeting, the work session was already mentioned. Planning and zoning, which you already all heard all that earlier today, so I can't report on that. And then I had my South Central, or my statewide emergency communication legislative meeting. I had a lot of items on the agenda, a few action items to deal with, a lot of talk about 911 and different pension programs for some of the custody officers and the dispatchers. So that stuff's just getting rolling. I had our MRCI board executive meeting for the finance. Again, they finished out extremely strong with all of the COVID money. There was a huge positive for them. They're trying to get the income or the better pay for the employees, so there was a couple increases for that, and they still managed to come out pretty well on that. So a few ditch hearings that were already mentioned. We were at the MICA annual meeting, which was a relatively full agenda, and I thought it went fairly well. Josh and I and Mark were up at that. They had some good speakers. Some good time to get back together and see some of those members, because Mark and I haven't seen them for a couple years. So good to get there. And then after the other county board work session we had, when the legislators came, Josh, I thought you did a great job with the legislators and the information we presented to them. I thought it went really well. We had a good turnout, and it was nice to be part of that. And then yesterday I had my South Central Workforce meeting, which everything's going really well there. They just had some annual reports to give us, which we will be getting a copy of them here to the office. And then I had my MVAC meeting last night, and again, everything's going pretty well there, purchasing a couple new buses, but business as usual. That's my report, Mr. Chair.
Thank you, Kip. Commissioner Landcamer, clean?
Hi. Well, work sessions have been mentioned. On the 11th, I filed my campaign finance report. I'm sure everyone else has on the board too. On the 12th, I had Region 9. They got a clean audit. They have a new accountant, Ty Backer. Lou is retiring. Updated their SENS plan. And we heard from Frank Polash, who's with NPCA on climate, and Jepala Kupano, who's talking about electronic vehicles. So it was an interesting time. On the 14th, Vance and I both had Transportation Alliance legislative. And talked quite a bit about the infrastructure bill. If we don't get a one-year appropriations with that infrastructure bill, if we don't get any additional money this year, it goes out another year. So something to think about, and encourage our Congress people to pass an appropriations bill. On the 18th, I had an Eco Central Committee meeting. And we talked about ARPA. They've changed some with the final rules. Some of the rules have been changed. If you're under $10 million, lost revenue can be spent on government services, and they've simplified reporting in about 70% of the counties. And cybersecurity modernization is now an allowable expense, and you can use a fiscal year or a calendar year. Our first report will be due April 30th of 22. February 18th, the continuing resolution has to be passed. We're assuming that Congress will do that, but February 18th is the drop dead date. On the 21st at RAC, we had a speaker, Dr. Ashley Stone, who talked about critical race theory, which is not being taught in Blue Earth County, which is a misconception by many people that it is. And that all started with the legal community. So it was an interesting background and history of critical race theory. And yesterday I had a meeting on inclusivity, I can't even say it, climate study. It's a partnership with GMG, Mankato Area Foundation, Mayo, District 77, Mankato, North Mankato, Nicollet County, Diversity Council, and MSU to get a read on our equity. It's a great partnership. Mankato Area Foundation is going to take the lead. They're looking at working with Michael Carter, who's Intercontinental Edge group. They've done a lot of work with 3M, Blue Cross Blue Shield, and other large companies in this arena. So more to come on that. I just thought I'd give you a little update on that. That's all I have, sir.
Okay, thanks, Colleen. And bring some of the warm stuff back. Come back. Okay, I had from, my report, January 4th, we have the board meeting. We did have the work session, and department heads on the 5th. I think Kevin and I were at that. And then the Tuesday, the 11th, was the final public hearing of the JD1 and JD2 final public hearing. And then Wednesday, the 12th, we did have the RETA. That Blue Earth County hosted over at our new government center building, and Bob did a good job, and that we actually had a little tour for some of them from Mankato Growth afterwards to see the building. There's a lot of people that haven't really had any cause to be in there before. Then we did have the work session on the 18th. And then, of course, Kip and I were up at Micah with Josh, and that was good to see everybody. And again, as Kip even mentioned, having that legislative session, Josh, again, with the, here in Blue Earth County with our local legislators was a well run in the meeting, and I mean, we had a good give and take there. So that concludes my report, and with that, call for motion to adjourn.
Recess, Mr. Chair.
Recess, I should say, yeah. Recess.
Motion to recess.
Recess, yeah. Okay.
Second.
Second. Motion and second to recess. All those be recorded by Stephanie to the roll call.
Commissioner Pat?
Aye.
Commissioner Brunder?
Aye.
Commissioner Stuenberg?
Aye.
Commissioner Landcamer? Chair Pipo?
Aye. The meeting's recessed till the
I think we're done.
Yep.
All right.
All right. Thank you much.
Good job, Mr. Chair.